Hi. I chose to cover Peru due to this country having the highest COVID death rate as a proportion of the population in the world and the subsequent aid package from the World Bank that followed. In South America, Peru has been severely affected by the COVID pandemic. By October 2020, the country had recorded over 830,000 confirmed cases and almost 33,000 confirmed deaths, contributing to a high incident and mortality rate. The impact of the virus in Peru is further exacerbated by a staggering excess death rate of 93,066 deaths of a population of 33 million. This makes Peru one of the worst hit countries globally in terms of both cases and fatalities. Social and economic impacts. In just 1 year, Peru's middle class suffered a major setback as the COVID-19 pandemic wreaked havoc on the country's economy, with an estimated 10% to 20% of the population plunging into poverty. It's evident that the consequences of the crisis were far-reaching. Job losses and limited income opportunities dealt a severe blow to the middle class, pushing them further in a downward spiral. The pandemic has also resulted in the highest death rate in the world, which left approximately 100,000 children being orphaned in just 1 year. Peru had the highest rate of primary and secondary caregiver deaths, which quite often were children, among the 21 countries studied in Latin America, with 14.1 per 1,000 affected children. These orphan children are at higher risk of experiencing abuse, with girls becoming sexually exploited and boys being forced into illegal mining operations. 1 out of 100 of Peru's children lost at least one parent during the pandemic, adding to the total of 550,000 children who grew up parentless. Child poverty increased, with about 39% of Peruvian children living below the poverty line. Some parents choosing to move their children to orphanages to ensure their children have access to food and water. Reasons for the high death rate are Peru's healthcare system being plagued by disparities in access, quality, and funding, with rural and marginalized communities being the most affected. The lack of coordination among healthcare providers makes it difficult to respond effectively to large-scale crises like the COVID pandemic. This leads to higher mortality rates and increased barriers in accessing timely testings, treatment, and care. Over half of the persons with COVID-19 symptoms did not use health services due to geographical and socioeconomic barriers. Peru's healthcare system was, at the time of COVID, and has historically had some of the lowest investment rates in the region that are linked to the neoliberal policies that were instituted under Alberto Fujimori. This led to limited infrastructure development and a shortage of ICU beds, medical supplies, and then later on during the pandemic, oxygen. The country is fragmented. The country's healthcare system is fragmented in many ways. Geographically, with only 60% of the population being covered by the public system, with the healthcare facilities being inaccessible to rural populations, as stated before. Overcrowded living conditions, and a huge informal economy further exacerbates the healthcare crisis in Peru, with many Peruvians relying on daily wages to survive and cannot afford to stay home, increasing the risk of transmission. The lack of financial support from the government further exacerbated the situation, hence forcing the people to ignore lockdown restrictions, further increasing the risk of transmission to other people. And again, the scarcity of medical oxygen became even more pronounced during the COVID pandemic, exacerbating the healthcare crisis. In response to the pandemic crisis in Peru, the World Bank responded with a $750 million loan to help mitigate the social and economic impacts of the COVID pandemic, with the program development objective being aimed at strengthening structural foundations for inclusive, sustainable, and climate-resilient economic recovery. The loan provided by the International Monetary Fund will support Peru's efforts to address the challenges posed by the ongoing pandemic and the aftermath. The funds will be used to bolster the country's healthcare system, provide relief to affected businesses and households, and to invest in sustainable and climate resilient infrastructure. The financial aid is crucial in ensuring Peru's path towards a more inclusive and sustainable economic recovery from the devastating impacts of the crisis. This is a statement of purpose from the World Bank. The stated expectations to the aid package, as stated by the World Bank, were that the aim is to alleviate poverty by providing financial support to those in need and ensuring that vulnerable groups have access to essential services. The cash transfer program will directly benefit individuals in the lower income brackets, providing them with much needed assistance. Additionally, the expansion of the National Household Registry will help identify and target those who require the most assistance, ensuring that resources are allocated efficiently. The formalization of Venezuelan refugees and migrants will not only provide them with legal protection, but also open up opportunities for employment and economic stability. I didn't mention it earlier, but at the time of the start of the pandemic, there were over 1 million Venezuelan refugees living in Peru that were fleeing political instability in Venezuela. Overall, these measures demonstrate a commitment to improving the lives of the most disadvantaged members of Peruvian societies. The structural reforms that are meant to create a solid basis for economic recovery by focusing on the important structural weaknesses of Peru's economy, which have become evident and were highlighted during the pandemic. These reforms focus on enhancing financial and digital inclusion, promoting competition, and supporting environmental and social resilience. The design of this DPF considers Peru's current political context, lessons learned from prior engagement through DPFs in Peru and other middle-income countries in South and Central America, and is in full alignment with the medium-term structural reform objectives of the CPF. So after Peru received the aid, the outcomes have not, there hasn't been drastic improvement. The pandemic has led to high inflation, which is still going on, which has hindered the economic recovery and poverty reduction. The economy is projected to grow by about 0.4% in 2023, and then in 2024 to 2.3%. Poverty has become predominantly urbanized after the pandemic, and that trend had began before the crisis, but it was accelerated by the pandemic, likely because people needing medical care making their way to the urban population centers and essentially being stuck there. In the past, sustained inclusive growth supported substantial poverty and inequality reduction, which has kind of been halted by the pandemic, but still is slowly grown, and that's likely due in part to the aid package. Had the aid package not been there, I think most evidence points towards the pandemic setting Peru's progress back decades. Overall, the current economic challenges, achieving such pre-pandemic growth and reducing poverty, has become pretty challenging. Definitely slowed. The government will need to implement targeted policies and initiatives to address urban poverty and ensure the benefits of the economic recovery reach all segments of society. Additionally, it's important to prioritize investment in sectors that actually have the potential to generate employment and generate economic growth. So they're going to have to be, the Peruvian government's going to have to be a bit more targeted in industries that they subsidize and try to promote growth in. It's evident, however, that without the aid, the economic detriments would have been far more catastrophic leading to declines in most other aspects of the healthcare, government, and social services. So the aid acted as more of a buffer than an overall fix for the negative impacts of the COVID pandemic.